3, 2, and we are live. Howdy, Fulton.
What's happening, Dr. Scott? How are you today?
I'm doing great. I think we had a great weekend.
Awesome.
It's been great. 4th of July weekend. Everybody got maybe a couple hours or a day off.
Hopefully. Happy 4th of July.
Everybody's feeling good. Happy Independence Day.
Yes.
Doesn't it feel good to be independent?
It does. It's an amazing place we live in, and this is the weekend. This is the time. This is the day that we celebrate our independence.
Isn't it
Thank
great?
you.
Isn't it great?
It's better. It's amazing.
What's awesome is we live in a country where we got freedom and independence, but they shut the beaches down, locked the beaches down, closed everything, and told you to stay home.
And it's more crowded now than it's ever been.
The place is popping.
It is happening. It is packed.
We are spreading corona more than anybody.
Anywhere. They're shutting it down, and the more they shut it down, the more people come. It's the old monkey theory. If you had 2 trees, one tree was full of monkeys, the other tree had no monkeys. One monkey fell off a tree. Guess which tree he's going to go back up? The one that's got all the monkeys on it. It just doesn't make sense. But it is magnetic. It happens every time. And this place is full of monkeys.
Well, you know what?
It is full of monkeys.
Well, it's because it's a nice tree.
It is. It's the best tree.
Myrtle Beach is a good place to be. We got our own Myrtle Beach's Rick Roberts with us today. What's happening, Rick?
Well, good morning, gentlemen.
Good to see you, sir.
I like the theory about the monkeys.
Yeah.
But I do not agree with about the Independence Day.
What do you agree with?
What's that?
No, I disagree with it.
Let's hear it.
We're not celebrating Independence Day.
What are we doing?
Do you see anybody doing fireworks? No, they've all been shut down. No city's doing fireworks. So our municipalities don't believe in Independence Day.
Now, hold on. Why aren't we doing fireworks? Because they're dangerous or because they come from China?
Because of COVID.
Oh, the crowd.
Oh, so the fireworks spreads COVID more.
Obviously.
Everything spreads COVID according to what we hear if you listen every day. If you go to Facebook and listen to what they say, everything's spreading the COVID and the corona.
Well, it's true. It's a virus.
It is a virus,
you
but
can't
it's
run
not
from it.
everywhere.
You're a doctor, correct?
Correct.
What is your opinion on the masks theory?
On the mask? Like wearing the mask?
Yes, constantly.
Well, here's the thing. Personally, myself, I look so much better with that mask on. I'll be honest with you.
We're not talking about how hot you look with it on.
I look so much better with half of my face covered up, and when I put my sunglasses on, it is on. Okay?
Yeah.
Put my bald cap on, you can't see my bald head.
You Mr. Sexy.
I'm personally in favor for the mask.
You are, actually.
When's the last time, Dr. Scott, you had a mask on?
I wear one every day in the medical office.
Okay.
Yeah, there's certain regulations that we have to abide by. Plus, with certain people, and we're taking care of some older population and some people with a weakened immune system. Whether I agree with the so-called science or pseudoscience of a mask, I also do it out of respect for others.
Yes.
I haven't tested positive, but I wear a mask because we're keeping a certain level of professionalism. And again, I don't have a problem with it. Like I said, I look at least halfway better with that mask on. Now, I will tell you and all the listeners, I'm going to tell you a little trick of what I do with my mask. I'm not just a typical normal put my mask on. I got to do something to make it a little exciting and a little better, a little flavorful, if you will. So I'll go into our medicine cabinet. I'll take a couple little drops of that nice, potent peppermint oil.
Yes.
I'll put a couple potent drops of peppermint oil in my mask. Maybe a little orange or tangerine flavor if I see another flavor in there for the day.
Yeah.
I'll drop it in there and I'll wear that mask and I will breathe that good juice in my nasal cavity and my lungs all day. So that's just a little tip. It makes that mask a little more exciting.
If you knew how that sounded right now.
I don't know how it sounds, but
sounded quite sexual there for a second.
It smells and feels good. I like it. I feel it on the inside.
But do you agree that people should be walking around outside with a mask on?
I think people can walk around with whatever they want on. That's what I think.
Do you think they should be made to do it?
Do I think someone should be made to wear a mask? Absolutely not. And do I think a mask is going to keep the virus from spreading? I don't think so.
And, well, I look at it like this. You know this about this. There is a mask out there that will stop any virus from ever getting into you. That's one of those big full masks. So why don't they just pass a law to make us all wear one of those? Because the little paper masks, that don't work. They've already proven this. They've done said that don't work. Yeah. And how about the cloth mask? Come on now.
Yeah, that's a joke.
Yeah. So, hey, there's different ideas, different opinions. Here's what I also know. There are people that feel strongly about masks. There are people who feel strongly about no mask. And unfortunately, that whole broad spectrum and the extremes on this way and that way, that's what's really causing the problem. It's not really the mask. It's these personalities on one end and the other end of the spectrum that actually mirrors the whole political society we have going on right now, the far left and the far right. It's the crazies that create a problem with the mask. Whether the mask works or not, no big deal. Should we have to wear a mask? Doesn't sound right. Should we wear a mask? Maybe at certain times. But it's the extremists on one end and the other end fighting and complaining and literally killing over a mask or not. It's unfortunate. It's unfortunate, and it's too bad, but that's the reality we're in. We're in the reality where the extremes, a small percentage of people on each end of the spectrum, who are all on that end of the spectrum, far end of the spectrum, they all probably have borderline mental conditions.
And I get that. If you've got underlying issues, you should be wearing a mask around somebody that's sick.
Agreed.
Guaranteed. I got that. That's common sense.
Yeah.
But if you're in a room full of healthy people, should they all be sitting there wearing masks?
Yeah, the mask I don't think is going to do anything. The mask is going to show some respect. It might do a few things, but here's the thing, guys. You know, last year, 50, 60,000 people died from the flu. We're talking about even children. This virus doesn't seem to attack children or have much effect on children at all. And we're acting like this mainly because we don't know much about the virus like we do the influenza virus. We're having this uproar, this pandemic, this new virus that we're unsure about, and that's why these precautions are there. But to really take it to the extreme of passing laws and telling people what they should and can't do, and whether they should be able to have a livelihood by opening their businesses or not, it seems a little extreme. But let's just face it. We're not just talking about the virus at hand here.
No.
There's a lot of factors to play here, from economic factors, political factors.
Huge. Of course.
We're in an election year, so it's not just the mask. It's also different people with certain personalities, attitudes, politics, economics. There's a lot involved here.
Exactly.
And you know what? I'm gonna say this. I think that the mask is nothing but a pre-test. It's a hidden test, okay? They're using a hidden test and agenda here just to see how much control they can take over our population, how they can control what people do and what people think. This whole, is the coronavirus real? Absolutely. But is it being used as a tool, as a weapon to control people? And here we are on Independence Day coming up, weekend, and they're trying to control us. This is who we are. We're an independent nation. We're independent thinkers. And if you want to wear a mask, you should wear a mask. But if you don't want to wear a mask, you shouldn't be forced to. The government should not be allowed to require you to wear a mask just because they said so. Because we look at the different states. If you have a Republican governor, if you have a Democratic governor, we're seeing wide extremes from South Carolina to North Carolina on what's taking place. And it's all about control.
There are a lot of conspiracies out there revolved around this and all these other issues that are happening in the country at the same time. It's like the perfect storm. And
it is.
And you can almost come up with anything, any reason. And I think there's potentially some aspects of, like you said, some control and what they'll do and not do. But even more so than that, I just think we're dealing with a certain level of foolishness and
stupidity.
Stupidity. That's
because,
what I agree.
I'm sorry, but, we got this certain thing called immune system. And if we don't test that immune system, then you're certainly going to be sick.
You're certainly going to be sick. Yeah, the immune system is just like a muscle. It has to be challenged. It has to be stressed to get bigger and stronger. And you're right. But that's going to happen anyway because there's no running from viruses. I
mean, think about it. What you guys do with Advanced Medical Solution. You fully expect your patients before they come in to be treated to be healthy at some point, to have a healthy immune system.
That's right.
So that whatever procedure you perform on them, like the gentleman last week, you want him to be healthy before you do anything with him.
That's right.
You don't want him coming in your office sick.
Yeah. So ultimately, it's all about building that immune system. We went over a few things. We had just a week or so ago, we had the local news station, WPDE TV 15, coming in talking about what are you guys doing to boost immunity? We're doing free B12 injections for our patients. We do vitamin infusions, vitamin injections. We're recommending vitamin D. You got to be taking a dose of vitamin D every day. Me, my kids, we take this vitamin D drops, and it's very good. Vitamin C, there are a lot of things, even just getting sleep, like you're supposed to get proper sleep, exercising, and your nutrition. These are all basic things that nobody in the major media is talking about. The major media is really, it seems to be, it's sad. It's sad because they take those extremes on one end and the other, both political, on cultural events, and instead of really talking about what needs to be talked about, which is building immunity, staying healthy. There's no cure for this virus. There's no cure for any virus. The key is you have to build a strong immunity. They're not talking about that.
There's no cure for the flu. You can get a flu shot and still get the flu.
There's no cure for it. The only cure is a strong immune system, which comes from a strong body and healthy lifestyle, doing the right things. That's where it's at.
Well, when you were talking about getting a good night's sleep, because I don't know if people realize that when you're sleeping, that's the time for your body to heal.
That's exactly right. That's exactly right.
Rest and recovery. Absolutely. Very important.
Thanks, Dave. I appreciate that. Yep. So we're doing some regenerative medicine, changing people's lives.
Having fun.
Oh,
loving what we do, man.
It's unbelievable to see the x-rays that I've seen. Dave was just talking about some of the regenerative medicine and x-rays. I'll be honest with you. I've been doing this for a long time. We were the first in the Myrtle Beach area, Grand Strand, really South Carolina, doing regenerative medicine, and still years after it, x-ray after x-ray after x-ray after x-ray after x-ray after x-ray after x-ray, and then again, just this past week, I see another x-ray, at least one, if not a handful, that blow my mind.
Let me ask you a question. What's the turnover time? You said you look at the x-rays.
That's right.
When they've had their first session.
That's right.
That you start seeing improvement. Away? Is it right away?
You mean improvement in the patient themselves?
Yes.
Immediately.
Wow.
Like immediately. I've had patients. We had a guy on here a couple of weeks ago on the podcast saying, I came in severe pain for years to the point to where he had to take a part-time job. Then he had to lose that job, couldn't do anything, had to get his wife to help him from the bed to the bathroom, from the bathroom to the recliner, stayed there all day watching TV and sleeping. That's all he had, and helped back to the bathroom and back to the bed. That was his life. He said he hit an all-time low. He said he came in, he got the injection.
Okay. Playing All-Time Low by John Bellion.
That's real radio for you, folks, right there.
All right. We better turn that off. We'll get charged for it. Thanks, Siri.
Yeah. Welcome.
What was I saying? He was at all-time low.
He was all-time low.
And then you gave him, and he got his first injection.
One injection.
Just one.
One injection. He said he left 85% of the pain in the office. He was 85% better before he left out the front door.
And you inject him with what?
Stem cell regenerative medicine.
And where does that come from?
That comes from healthy mothers who give live, healthy births, and they're choosing to save and donate the birth tissue, specifically umbilical cord, the birth tissue for medicine, for themselves and for other people like us.
Now, there at one time, wasn't it like not allowed to do the whole umbilical cord stem cell?
Well, no, that was more so. And sorry, Dr. Scott, didn't mean to step in all over you there, but this is one of the areas where I put a lot of effort and focus and try to help allow you to see patients so I can go do the research and bring the information to you. So here's what you're discussing, Rick. Back in the late 90s, Superman, Christopher Reeves.
Right.
He was doing the stem cell because of his accident, okay?
Yep.
Unfortunately, at that time, they were using embryonic stem cells, and that's where religion and science bumped heads, okay? You had a clash like you've never seen. So the FDA shut it down.
And real quick, embryonics, the reason why they were using embryonics and the reason why there was a clash there is because there is this debate or efficacy of aborted fetal tissue and aborted embryonic tissue. So that's where the issue was, abortion and then using that for medicine.
Exactly.
I know, but okay, so that would be considered an oxymoron. But at the same time, too, wouldn't you want to take that as saying, okay, well, that happened, but why don't we use that for good?
So that's what they did. You know, they shut it down. It took 20 years for the FDA to act again. And in late 2017, almost 20 years exactly later, they opened up a moratorium, which has given us what we are under now. Dr. Scott and I took full advantage of that from the very beginning. So what is being used now, as Dr. Scott was saying, it's actually a healthy birth. They start screening these mothers at 24 weeks, okay? Do you want to keep your afterbirth for your child, put it in storage in the event your child has an issue that needs to be addressed in the future, and you can thaw it, process it, and use it for your child's treatment, okay? Or you can donate it to science. And by donating it to science, that's where our product comes from. So they capture all that after birth, and it is from a healthy birth. They screen these mothers. They screen them extensively. There's a lot of things that prevent them from being able to donate, and less than 50% actually get to. It has to be a scheduled C-section, okay? So it's not somebody rushing into the hospital, dropping off a baby, and you cleaning up what's left on the the birthing table. It's actually from that scheduled C-section, and it is processed into many different things. And there's a lot of tissue. There's a lot of different places that it comes from, everywhere from the amniotic fluid, the placenta, umbilical cord, which is the Wharton's jelly, and then the actual cord blood, which is one of the gold standards as it works its way through, the FDA to get its final clearance. But Dr. Scott and I have worked with those products for a long time and really seen amazing results there.
So I'm going to assume that not just somebody's knee that needs to be repaired, but y'all are now reaching into the areas where you could probably, somebody was paralyzed, you could maybe make them walk again.
Oh, they've done it.
Or how about dementia, Parkinson?
That's right.
Absolutely.
Ultimately, what we're looking at with regenerative medicine is, I call it the new medicine. It is the new medicine because there are avenues and applications for this to be used for almost any condition. One of my most favorite research papers talks about 53, in just one particular paper, 53 different pathologies, disease processes that have been significantly helped, if not reversed, significantly by patient outcomes and clinical laboratory findings. That significant changes, 53 pathologies, over 2,000 patients in this one particular study, including neurological conditions, cardiac problems, musculoskeletal conditions, autoimmune conditions, all these issues, 53 different pathologies have been helped significantly with stem cell regenerative medicine. There are different ways of applying it. We have to follow the FDA regulations, and we got to let them get their piece of the pie before we can really unroll it to all these other avenues. Currently, we are doing things off-label because it helps people out so much. But the most help that we're seeing with people are trying to get out of pain and avoid surgery on their joints, ligaments, and tendons.
That's pretty good. 53. I mean, I can imagine that in the next several years, it's going to be more than that.
Yeah, and Rick, also don't forget that the current administration. President Trump has given us the right to try. Okay, so this was something that couldn't be done before. We now have the opportunity. If you have a patient and you have a physician willing to participate with that patient, there's no other treatment out there for that patient's condition. They have the right to try what they want. And this is another avenue that has allowed stem cell to progress as far as it has in such a short amount of time. And I can promise you, if they were having significant issues with these patients out there, they would shut this down. Okay, they would not allow patients to continue to be put at risk, because always remember, the FDA is reactive, not proactive. Okay.
I want to disagree on that real quick. The FDA is very proactive for certain things, especially if it's backed by the pharmaceutical industry.
Well, now we're getting back into the political conversation again.
And the economics part.
Yes.
Now, I will tell you this right now. If our treatments that we were doing in advanced medical, if they weren't so effective and so phenomenal, if they were killing the amount of people that those opioids killed last year, advanced medical would not exist. And this guy right here would be in jail. So the FDA is proactive on how the FDA wants to be proactive. And right now, they're actually reactive. They're trying to get their hands, well, the FDA and the other players involved. It's an economic and political pull and push. And that's fine. I don't have a problem with it. But it shows you, like you were saying, if there was any problem with what we were doing, it would be shut down immediately.
Quick.
And as opposed to some things that we really do have serious problems with, are not shut down, and they're still being prescribed and utilized right now.
Exactly.
So there's a huge, what do you call it? There's a huge, I don't want to call it two-faced. There's a huge
variance.
Double standard?
Yeah.
Double standard.
Good word.
Thank you, of what's going on here. And you know what? It's okay, because we got a lot of people getting better. We play by the rules, and what happens is there are huge groups and organizations making decisions, and that's just something that takes more time. It takes more time, and it's okay.
Yep.
At least now we're able to do what we can do, and it's changing people's lives. It's helping people avoid misery, pain, suffering, and surgeries. And we're going to play by the rules. As a matter of fact, we partnered up with the FDA last year.
Yes, we did.
And so we're helping them in this slow but sure evolution of medicine is really what it is.
Yes. And Rick, I'm gonna tie into something that Dr. Scott's saying there, and actually about the question you asked before. You were asking how quick these patients see a response in getting this stem cell injection. Dr. Scott's response was immediately, okay? And what he's referring to there is the pain. Okay, the pain is one of the biggest issues that drive these people to advanced medical solution and get them started in this, in this protocol or this type of therapy of medicine. But the other side of it, not only does it take the pain away, many times, almost immediately, then we start to see the regeneration of the damaged tissue after that. And that continues. So that doesn't just end when the pain goes away. Just because the pain is gone doesn't mean that the work is finished. The work's actually just getting started. And
it really hadn't even started.
It had. That's right.
Yeah, it takes those cells 2 to 4 weeks to actually come out of their dormant phase.
So what Dr. Scott talks about when he says he's seeing these x-rays, he's actually seeing this regenerated tissue in these x-rays. It's documented. It's fact. It's not fiction. It's not magic. It is real.
It's never been seen before.
No.
It's never been seen before, actually, reversal of degeneration. Degenerative diseases actually regenerating. And that's what we're actually taking pictures of, and we're seeing it happening as little as 3 weeks on x-rays. We're seeing it definitely happen within 3 months. And we also have patients and patients specifically chosen to extend that examination and x-rays out over a year. One particular x-ray I have is a year and a half after one injection. We made sure this patient was treated with nothing else other than this one injection in a left knee, and we're studying that knee with one injection. The last x-ray we have is a year and a half out, and the knee is continuing to regenerate a year and a half after one injection. Thanks, Dave. Hey, between those vitamin IVs, vitamin injections, and that peppermint I've been snorting for the past 2 weeks in my mask, I swear my sinus cavities are draining like no other.
What's it taste like?
I love it. I love it. It tastes like health. Tastes fresh. But anyway, thanks, Dave. Yeah, we do all these vitamin infusions. It's awesome. Vitamin injections. Oftentimes, we'll do vitamin injections that drive our regenerative medicine to certain systems, like the neurological system, the brain, the pancreas for diabetes.
Might have to come up here and get one of those.
They're good. They're good.
Don't wait.
One of the things I noticed from them, what I love about it, all right, here's the thing. I'm an energy junkie, okay? So I'm laying in that chair, this nice massage therapy chair. I'm laying there, and I'm like, okay, I'm getting this vitamin IV. I'm going to have some energy in just a minute. I'm going to be ramped up. I'm sitting there, and I'm not the type to like to be still. As soon as I'm still, I start getting drowsy. I'll go to the movies. I will pass out before the movie starts, okay? Because if I'm being still, I'm out. I'll sit in this chair, and after about 10 minutes, 15 minutes, I'm seeing those vitamins drip into my veins, and I'm getting a little more tired and a little more tired, and I'm tired. I'm like, this shit ain't working. I'm already tired. What am I even doing here? By the time I'm done with the vitamin IV, I'm pissed off. I came here to get some energy. Now I'm as drowsy as I've ever been in my life. However, next morning, 3 a.m., 4 a.m., 5 a.m., whatever time I get up, I am popping up and I'm ready to go. So I have to get past that initial immediate pleasure that I want to get and have some energy right now from the IV. And I've gotten past that. I still complain about it, but I know that once it gets in my system and I'm processing, my energy is up. And it just gives me, once I sleep it off, and it's not that happens all the time. It's just when it does happen, I complain about it.
Well, I guess I'm going to have to make an appointment.
I'll have her call you up. We'll get you set up.
There you go.
You will not regret it, Rick. I promise you, once it's, I don't want to use the word addictive, okay, but the feeling you start to receive physically, emotionally, mentally, all the way around, it fuels the next stage for you, okay? So it just catapults you to the next level, and you don't want to lose it. It's one of those things that once you've got it in your hand, you don't ever want to let it go, and it causes you to focus more on what you're doing and to keep yourself healthy, and it's the snowball effect.
Before we wrap this up, what is the future?
What is the future of what?
Advanced medical solution.
Oh, well, based on our discussion and the needs of the community and what's actually happening, we're going to continue to offer the most innovative treatments with stem cell regenerative medicine. We're applying it in multiple ways, directly into joints, ligaments, muscles, tendons. We now have breathing protocols for COPD and ways of infusing it straight into the lungs for asthma, emphysema, COPD. Eventually, pretty soon, there'll be target stem cells where we'll be able to target stem cells to certain organs, specifically like the heart, the lungs, even better than we're targeting them now. We're talking about the cells specifically are going to be going to those areas.
Yes.
Then next what's going to happen is we'll have these immune modulating protocols, which we already have off-label, to stimulate immunity. Then the next phase, probably within the next 5 to 7 years, is we're going to incorporate gene therapy. It's going to be gene therapy, and we're talking about it's commonly called CRISPR, where we're re-engineering genes utilizing stem cells to carry those factors and tools, nanoparticles, into the body to actually start changing genetics. One of the first studies being done right now is for sickle cell anemia, and so that's what's coming, and we are already on top of that. And we're going to be bringing it to Myrtle Beach. We'll be one of the first in the world, and definitely the first in the area offering this to our people. It's already in the mix. That's about it. That's what the future is, and I'm excited about it.
Me too, Dr. Scott. Happy 4th of July. Thanks for having us. Everybody enjoy their weekend. Be safe, be strong, and God bless America.
Hey, Rick, thanks for being here.
Thank you, Rick.
Thanks for being here, Fulton.
Thank you, Dr. Scott.
Thank you,
My pleasure.
everybody. We'll see you next time.